Welcome back to another podcast of Heal Without Harm. My name is Dr. Clayton Dir, physical therapist and the one bringing you the truth about the medical system. Today's podcast is going to be short, sweet, and to the point. It is going to be over IT band pain syndrome, ultimately lateral knee pain with any sort of walking or running. Most of the people showing up here are probably going to be someone that is a runner or a long walker, because that is the most common thing that flares up IT band pain. And that's the most common person I see who generally shows up and has it. Let's talk about what the IT band is, what you should and shouldn't do to make it go away, and then a quick little template on what to get started with right now to calm it down. So the IT band is ultimately, I actually heard this from a student of mine who is now a practicing physical therapist, but the IT band is like the Achilles tendon of the upper leg. What I mean by that is you have your calf muscle that turns into a cable or a tendon, which is your Achilles tendon, and attaches to your heel. Your IT band is the equivalent of that, but instead of your calf turning into the Achilles tendon, it is your glutes turning into your IT band. So you have these muscles on the back side of your pelvis, the lateral side of your pelvis, and actually that front corner. There's a bunch of muscles that all come down and they attach to that bone on the side of your hip. Fancy word is greater trochanter. And that is where the IT band is started and formed. And then it goes down the side of your thigh to the lateral portion of your knee. Technically, it attaches just below the knee, which is why that 5 to 10 degrees of knee bending can be so painful. So if you're sitting on a couch or something with your leg outstretched and your knee is fully straight, and then you bend it about 5 degrees, from 5 to 15 degrees is generally going to be the most painful portion of that. And that is because the IT band, that thick, dense tissue, is rolling over or sliding over a bony portion of your knee. This is made to happen. This is supposed to happen. But when that tissue is tender and painful, that is going to be 6, 7, 8 out of 10 level pain. Pain does not always equal high level damage. Sometimes it's just high level sensitivity. But that in a nutshell is what the IT band is. Now, as I talk about this, I want you to now picture the IT band. It's 2 to 3 inches wide, sometimes a little bit bigger, sometimes a little bit smaller, but it's very, very thin. It is like a sheet of tissue that goes down your lateral thigh. Oftentimes, people, in an effort to decrease this pain or decrease this problem, they will roll out the IT band. I want to debunk that right now. There is no rolling out this tissue. What you are actually doing when you are rolling on this thing is you are, yes, pressing into the IT band, but you are more specifically working out the lateral quad, or rubbing out or working knots out of the lateral quad. If you were to take your leg, and let's say you're sitting down with your leg out straight in front of you and your toes pointing up, if you were to take your toe and point it inwards, which is going to bring your outside thigh more towards the sky looking up, that lateral quad is actually going farther back on your thigh than you would think. So when you are rolling on what you think is the IT band, you are rolling on it, but you're more affecting the quad underneath. If you're having IT band pain, and it's probably around that lateral knee, where you actually need to do your soft tissue work or rubbing with a ball or a foam roller, is up at the hip. You actually need to hit the back of your butt cheek, the side of your butt cheek, and that front corner of your hip. And as you go through this, please do it with caution, as you're going to notice it is very tender. It is very painful. And when you find those spots, I use the term search and destroy. I want you to find those tender spots, pin them down and hold them. It may get up to a 6, 7 out of 10 pain, maybe 7 or 8 out of 10 pain or intensity. And you're going to hold that for about 30 to 60 seconds. If you can tolerate more like 60 to 90, I would actually recommend that. And what you will notice is after that first 30 seconds or so, whatever your pain level is going to start to drop. You will notice the pain starts to actually decrease, which is you effectively treating that trigger point or that spasm or that knot in the muscle. Now beware, this is temporary. These knots are there in reaction to whatever you're doing. Most of the time, IT band pain comes on because you've done too much too soon after doing too little for too long, aka you are underprepared or you are overusing that muscle, mostly the hip. Sometimes the quad can be a piece of this. And so you're going to do some soft tissue work to that portion of your hip. And then, yes, you can go down into the quad and work that as well. After you've worked out those areas, you're going to start strengthening these muscles. I don't really have a test for you to test if you're strong or weak in these muscles, as the best test ultimately is getting evaluated by a physical therapist. So that is what I would recommend. But if we want to make the assumption that you are weak, you are going to do exercises like 90-degree clams, which is when you are laying on your side. You draw your knees up almost like you're going into the fetal position, but you stop when your femur or your thigh bone and your chest are at a 90-degree angle, and your knee will also be bent to 90 degrees. You will open your knees, bring it back down, repeat that for 15 reps, and then roll over and do the other side. You'll do 3 sets of 15 on 90-degree clams. This will strengthen up the bottom part of your butt cheek. The second exercise is one called 7-way hips. That's going to be a long explanation. So if you're listening to this now when you get safely to your destination, if you're driving, the top link in the bio will have my name. It'll be thedocdir.com. Click on that. It'll take you to some different protocols that I have. If you just want a couple pieces of information without having to spend any sort of money, please message me on Instagram, Facebook, or TikTok. Get me on one of those and I will send you a couple of things to get started at absolutely no cost. I will get you taken care of there. Moving back into it, you want to strengthen the hip in those two. There is probably a knee portion to this as well, and there is an exercise called knee isometrics. There was a study done that they found for patellar tendinopathy or patellar tendonitis, so not specifically to IT band, but I've seen it work for numerous patients. You will actually stand on one leg, bending the knee to about 60 degrees, and then hold that for 45 seconds, if you can tolerate this. The research studies actually say that you should do 5 sets of 45 seconds, but most of the time I will dose people at a lower level than that, maybe 3 sets of 30 seconds. It'll be painful while you do it, but it'll gradually get better. Just like when you did the soft tissue work, it'll gradually get better throughout that 30 seconds. This would be the starter package that I give most people. 2 hip exercises and 1 knee exercise. What you are doing by doing these exercises is you are building up the tissue capacity in your hip and your knee. You are essentially making them stronger or more prepared for whatever task you are asking them to do. Walking, running, jogging, sprinting, weightlifting, whatever your choice of movement is, you are bringing up their capacity to a level in which they can actually tolerate the activities that you are wanting them to do. And that is IT band in a nutshell. I have seen patients who have gotten IT band releases where they surgically expand the IT band. I have seen people foam roll to no end on these things along their lateral thigh with little to no benefit. In my experience, this is usually a very straightforward type of diagnosis and treatment plan. And if you need some help with this, please get evaluated by a good physical therapist. Most treatments look like dry needling to the quad and to the hip. Scraping or ASTEM or Graston if needed, but dry needling is usually more effective. And then a gradual progression back into lifting or into running or whatever the activity of choice is. If you have any questions, please, like I said, reach out to me on one of the social medias or send me an email at clayton@teamnaturalwellness.com. I will have all of this information in the description below. So when you arrive at your destination, because you are most likely in the car, you can drop down into there, click the link, and it will take you where you need to go. Thank you guys for listening. Like I said, this is a short and sweet podcast over IT band pain. If you know someone with this pain or you have a runner in your life that needs some help, please send them this podcast as it helps me significantly on the back end. And I am done quite well growing this by the efforts of you listening. So thank you so much.